I'm not.
Come in.
Hey, my name is Amber Jones. I'm gonna be your student nurse today. Can you tell me how are you?
I'm doing okay.
That's good. Wash my hands. Put my gloves on. Can you tell me your name and date of birth?
Lisa Holmes, 02/14/1995.
Okay, can you tell me the date, time, and where you are?
The date is 9/3/20. Time is about 6:05, and I'm in Meridian, Trinity College.
Okay, can you tell me who the president is?
President Donald Trump.
Okay, on a scale from 0 to 10, with 0 being no pain and 10 being the most excruciating pain you ever had, can you tell me your pain level?
0.
0, okay. Can you tell me when was your last bowel movement?
Yesterday.
Okay, and how was that? Tell me about it.
It was soft and brown.
Okay, and how do you burn while urinating or anything like that?
No.
Okay, so I have some more questions that I need to ask you on the front end. Can you tell me when was your last pap smear?
3 months ago.
Months ago. Okay. You know, the recommendation is for you to have one every year. Can you tell me when was the last time? Well, tell me about your diet.
I eat a well-balanced diet 3 times a day.
Okay, and tell me about your exercise regimen. Do you exercise any?
No, ma'am.
No. Okay. You know, it's recommended that you exercise 3 to 5 times a week for 30 minutes a day. Okay.
Okay.
All right. So I've asked you pretty much all the questions that I need to know on the front end. Okay.
Okay.
All right. So also, my patient is alert and oriented ×3. She's pleasant, and I've noticed that she doesn't have any kind of oxygen or anything like that in her room, or any kind of dressings or drains. All right, so next we're gonna get started with our assessment. I'm gonna check your eyes first, okay? All right, and also I need to raise my bed up to working height. Okay, so. All right, pick a spot on the wall, look straight forward for me. Okay, so next I need you to follow my light. Don't move your head. Okay, thank you, ma'am. And as I was assessing her eyes, her pupils were equal, round, reactive to light, and accommodation. Next, I'm going to assess her mucous membranes. Can you lower your mask for me? Open your mouth. Thank you. All right. So, now that I have that out of the way, I'm going to check her carotid. They're equal and bounding. I'm gonna check skin turgor, and it's prompt. I'm gonna check her skin. I notice no edema, it's brown, no lacerations or anything like that. Okay, can you flip your arms? Yeah, thank you. Okay, brachial pulses are even, bilateral, radial is even, bilateral. Okay, nail beds are even, capillary refill is less than 3. All right, so now I'm going to test your strength. So can you cross your arms like this for me? Okay, I'm going to try to pull against you, and you keep them against you. Try to keep it against you. Okay, push against me. All right. Okay, my patient is even, strength is even bilaterally. All right, so next I'm going to listen to your lung sounds, and then I'll do heart sounds. But now we're going to do lung sounds first. Take some deep breaths for me. Okay. 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 Next, I'm going to be listening to heart sounds. Aortic, pulmonic, tricuspid, and mitral. Okay. So S1 and S2 were normal rhythms. Okay. So can you turn to your side for me? Okay. Listen to your Okay. Can you turn over on your other side for me? Okay. Now, I need you to turn over for me. I'm going to check the the lung sounds on the back. Okay. And I'm going to assess her bottom and looking for any redness, skin breakdown, and she doesn't have any. Okay, you can roll back over for me. Okay. So next I'm going to inspect her belly. I don't see any redness or anything like that. Have you been having any kind of pain in your stomach or anything? Mm-hmm. Okay, so now I'm gonna listen. make sure to tell me if you have any kind of pain or tenderness as I move around. Any pain or tenderness?
No.
All right, that's good. All right, so next thing. There. I'm going to check your femoral. And they're supposed to be in this region, but they're not palpable, okay? So as I'm going down, I'm looking at her legs. No edema is noted. No redness or edema to the calves. I'm gonna check the popliteal, and they're even and bounding. As I go down, I'm assessing her posterior tibialis and dorsal pedis on the top. And I'm also looking for any skin breakdown on her heels, anything like that. And capillary refill is less than 3. Nail beds are even. Okay. So at this time, oh yeah, and I need to assess your strength down here. Okay, cross your legs for me. All right, so you try to keep them down, and I'm gonna pull on them. Okay. Okay. All right, undo them. All right. All right, so bilaterally, strong on each side. Okay. So I'm gonna leave my patient comfortable. Do you need anything? Okay.
No, ma'am.
All right. So let me know if you need anything. I'm gonna wash my hands and leave my patient in a comfortable position. Call Bill and Reach.